How you doing there? I'm Dr. Jeff.
Hi,
Nice to meet you.
Nice to meet you.
So what brings you in today?
I've been having some pain around my ankle when I run.
All right. Tell me about that. When does it come on?
If I'm running, it's different at different times, but lately it's been pretty consistent. If I start to run hard or up a hill, I just get hit with it. It started out just once in a while. It was kind of mild, and now it's pretty consistent, and now it gets pretty bad sometimes, or I just have to stop running.
Where would you say the pain's worse at?
Right,
point.
right here, right along here.
Okay. So tell me about your training regimen.
I've been training for a triathlon. So I'm swimming and cycling and running, and it only happens when I run.
Okay.
So I started out running a couple of miles at a time, a few times a week. And I only run 3 times a week, but I've been doing it more and, longer distances. And so I'll run 2 miles once and then maybe 3 and 6 miles the other times. And I've been ramping it up. I started out with short distances, and now I'm up to trying to do 6 miles, but I can't get to that now.
Okay. Has there been any changes in your footwear or in your training volume here lately?
Yeah, and the sneakers are the same.
Okay.
But I want to do an Olympic distance triathlon, so I've started running longer distances. And I used to do 2 to 3 miles, and because it's an Olympic distance triathlon, 6 miles, so I've started trying to run 6 miles. Okay. And it happened when I started doing it more, going longer.
And you said your shoes are old. How long have you had your shoes?
6 months, a year, I don't know.
Okay. All right. So you don't change your shoes frequently?
No, I haven't.
Okay. All right. And have you ever had problems with your feet, ankle, knees on that side or the other side?
No, my knees are fine. I had flat feet, I was told when I was a kid. Mm-hmm. So.
Okay. All right. And any numbness or tingling in the feet, anything else that goes on with that?
No.
Now with the pain, does it go away when you stop running?
Yeah.
Okay.
If I walk, it's okay. But once I start running, it's like bang.
And does it bother you when you're just walking around, when you're not running?
A little bit. It's nothing like when I run. It's just I know it's there, but it doesn't inhibit me at all.
Do you notice it when you wake up in the morning?
No, not really.
Have you had any treatments for this?
No.
No.
This is the first thing I've tried to do about it.
And do you have any thoughts on what's going on, or have you read anything?
I'm pretty sure it's my Achilles, and there's all kinds of stuff out on the internet, so.
Yeah, of course. And there are many things. Achilles tendinopathy is our most common condition. You may hear other people call it tendinitis. Most sports physicians don't use that term anymore because it implies inflammation. But it's good that you're here early. This can go on to be a chronic problem, and it's good that we're dealing with this early, see if we can get at the cause, and also get you back out there running full speed.
Great.
Okay. What I want to do is kind of look at a few things here on the examination. Really, I want to look at the back of your leg and the Achilles, but before we do that, I'm going to look at your alignment, some of the functional tests to just kind of see the players and how they relate. The muscles, the tendon, the bones, all those are related and can give you problems with the Achilles tendon.
Okay.
So what I'm going to have you do here first is just stand up. And just looking straight at me, I'm going to take a look at your arches here. Okay. And then I'm going to have you come up on your toes. Great. And you can go back down. Any pain with that movement?
No.
No pain whatsoever. Okay. Great. And then what I want to do now is check your flexibility of your calf muscles, the gastrocnemius complex. What I want you to do is keep your heels straight and go as deep into a squat as you can and come up without raising your heels. And then on up. Okay, great. I'm going to have you lay here on the bed with your feet hanging off the edge on your belly. Okay. Really what I'm doing here is just looking at the Achilles, comparing them side to side. When you do have Achilles tendinopathy, usually one Achilles is a little bit thicker than the other. And while we're sitting, you pointed to your right. I just want to make sure that we are talking about your right Achilles. Is that correct? Okay. And side to side, they look very similar. There might be a little bit of thickening here. And what I'm going to do is start with your good one and just go through the range of motion here. And I'm going to push you as far forward as I can. So you have good dorsiflexion there. You get up past neutral. not being able to get up past neutral is one of the risk factors for problems with the Achilles. And then I'm just going to push on here. Any tenderness if I push around?
There is, yeah.
Okay. You tell me when I hit that area.
Right there.
Okay. And how far up does it continue? Do you notice any? Okay. All right. Now I'm just going to relax your foot, just take you through the range of motion. Sometimes when you come in really soon, we feel a little bit of crepitus or a little snap, crackle, and pop in this area, and I don't feel that. And I'm going to feel around some of the areas, your calcaneus or your heel bone, the area behind the Achilles tendon for any sort of bursitis or inflammation not related to other things about the Achilles tendon. And come up here just to make sure that this isn't related to a muscle strain or anything like that. No problems with squeezing of your gastrocs here. And I'm going to have you push against my hand. Any pain with that?
Yeah.
In that same area?
Yeah.
Okay. All right. Go ahead and relax. All right. I'll have you sit up for me. So I do agree with your concern about the Achilles tendon. It's very common, especially with running. There's many different risk factors that we can talk about. So what are we talking about? We're talking about an Achilles tendon that's diseased. And what's wrong with it? It's just been used a little bit more than it can handle, either loaded too much or not given enough time to recover. It's perfectly fine to continuously load this. It takes 12 times the weight of our body, but it needs time to recover. And with your increase in your volume, it's probably just not allowing your Achilles tendon to heal up.
Okay.
Where you point is the most common area of Achilles tendinopathy, and it's right there in that mid portion, about 2 to 6 centimeters above the calcaneus or the heel bone. There are other conditions that can give you pain about the heel, and it is important to be evaluated to make sure we're not dealing with any of those things. The most common type is the mid portion Achilles tendinopathy, and it is very responsive to physical therapy, rehabilitation. So coming into the office sooner when you have Achilles pain is much more beneficial for you in the long run. What I'd like to do is, I think this is something that we can recover here since it's only been a couple of weeks for you. I can give you some home exercises, but at the same time, if you'd like to see formal physical therapy, we could do that too. Do you have a preference one way or another?
If I can do it at home, that'd be all right.
Okay. All right. The first thing for treatment that we're going to encourage you to do is relative rest. The biking, the swimming, things that don't cause you any pain, perfectly fine to continue. Okay. But if you're having pain in that area, that tendon is not healing. So relative rest from the running, but you can keep up your running form by pool running, considering elliptical or treadmill running if those aren't painful.
Okay.
But we want to start with pain-free activities, and keeping up the cross-training is perfectly fine. But we want to rest that tendon, allow it to heal. Other things that can help with that are just simply using ice 4 times a day for 20 minutes, icing that area down. Okay. Then with rehabilitation, with a formal physical therapy, I don't say this much, but that should hurt, and what you do at home may actually make this tendon hurt. But that leads to better healing of this tendon, and the sooner it heals, the better off we are.
Sure.
Do you have any questions about anything I've said so far?
No. The ice, and you're going to give me some exercises?
Yes,
Okay.
and I'll kind of demonstrate those for you over here. When we talk about the Achilles tendon, we often think of heel lifts and things like that on the edge here where people come up. And that's what we call concentric exercises, where the muscle is shortening and you're coming up onto the heels. It is a way to strengthen your Achilles, but to put more stress on the tendon and to help it heal up, we have to do what's called eccentric exercises. So what I would want you to do is come up into that heel raise position with your good foot, and then weight your affected Achilles and come down. Now, as you do that, you might want to do something where you have more balance on a stair or where you can hold on to the rail. But you'll do 3 sets of 20 times, 20 descents, or concentric contractions. If you can do that 2 to 3 times a day, that's a start. Sometimes it doesn't work at home, and if so, we can get you into formal physical therapy.
Okay. So when should I start running? How will I know?
So that's a good question. First, we want to get you to a pain-free state, get you into these exercises to where you feel like you can do them unweighted without pain. And then I say a gradual return of your running, and it'll be a conversation that we have back and forth as far as how much pain you're having. What I say is a little bit of pain is okay, but if you have delayed pain, that pain is 2 hours after your run, that was too much. You have to back off.
Okay.
Okay. So I kind of leave it in your hands. Being an athlete, you generally have a sense of how to listen to your body, and I do need you to listen to the body. These exercises may be painful. When you run, I do not want that to be painful.
Should I stay to flat running at first, or are hills okay?
Flat is going to be generally less painful. You told me that you were having problems when you're running hills. It may have been related to that. It may have been related to the volume also. So it's going to be a lower volume. It's going to be generally flat and easy running.
Okay.
All right. So some people want to know what's going on. What is the anatomy of the Achilles tendon? It's actually the two heads of the gastroc muscle that come down along with a deeper muscle, the soleus, and they join into a tendon called the Achilles tendon. That tendon runs and inserts on the back of the heel bone or the calcaneus. Now sometimes doctors will get x-rays to look for any sort of heel spurs or anything else that may be contributing. In the mid portion of the Achilles where you are, often that doesn't add anything, however it will often be obtained. In addition, some sports medicine physicians are utilizing ultrasound and looking specifically at the tendon. An abnormal Achilles tendon will appear thickened compared to the other side. In addition to us, we'll see disease within the tendon with ultrasound.
So what do I need to do now?
I think with quick follow-up, seeing me in 2 to 4 weeks, I think we can hold off on any imaging at this point and just see how you do. And this will be a dialogue that we have back and forth.
Okay.
And I want to get you back as quickly as possible too. So I would recommend a 2-week follow-up. Tell me how the home exercises are going, and then if we need to get more aggressive with our treatment, we would do that.
Okay.
Does that sound like an okay plan?
That sounds good.
Any other questions? A very good question.
I can bike, I can swim. What about like long walks?
As long as they're not painful.
Okay.
Use pain as your guide at this point. And I want all activities of daily living, the walking, taking the dog for a walk, cleaning, going up and down the stairs, to be pain-free.
Okay.
And as long as you're pain-free, you can continue to slowly increase your volume.
All right. Okay. That's it. Thank you.
This case here today was just for your information and was a very typical case. However, I do encourage you to seek out attention at the first sign of Achilles tendinopathy. There's a lot that a sports medicine physician or anybody with appropriate training would evaluate in addition to what you saw here today. One thing we did not discuss in this case today is sometimes Achilles pain can go on to be chronic. Therefore, it is important to come in at the first sign of Achilles tendinopathy. With that in mind, it's going to be very important to work closely with a sports medicine-minded physician and or physical therapist to appropriately diagnose this and start treatment as early as possible. What we want to do is keep you out there running, biking, and swimming, and early treatment and prevention are the best means of doing that.